We're live at the Democratic National Convention in Philadelphia, Pennsylvania with Deborah Burger, the National Nurses Union. Deborah, great to have you on Free Speech TV. How are you?
I'm doing great. Thank you very much.
Well, there's so much going on today. I noticed your sign, I'm with Nina. Talk to me about that. She's a very close friend of the National Nurses Union. It is really hard to believe all this emotion over the last 24 hours and how this has been handling. What are your thoughts there?
Well, our thoughts are with Nina Turner. The nurses have worked with her since day one on the Bernie Sanders campaign. We've developed a relationship with her. We've come to trust her and really rely on her to get the message out to everyone involved nationwide. We've been state by state campaigning with her, and it was really a disappointment. We expected to see her doing the nomination with Tulsi Gabbard, and all of a sudden she wasn't there, and we just wanted to know what had happened. Lo and behold, we find that she was told that she would not be participating in the nominating process. She was no longer welcome on the stage, and we're disappointed because we thought that Senator Clinton's campaign had said, we're an inclusive tent, we want everybody with us, we want the Sanders people, and yet her actions are speaking louder than her words, and we really are dismayed at what's happened with our leadership. And if she wants the Bernie Sanders supporters to come along, then the Clinton campaign needs not to disrespect one of our best spokespersons for our political revolution.
Talk to me about where we are in terms of your thoughts about the Clinton campaign, in particular when Terry McAuliffe talks about flip-flopping on TPP. You guys have worked so hard along with a lot of other labor folks on this issue, as has Senator Sanders. How does this make you feel when you have this kind of, just off-the-cuff remark that really goes at the heart of the trustworthiness that Secretary Clinton has some bad poll numbers on?
Well, nurses are used to politicians flip-flopping. That's nothing new. And we will continue to actually push the TPP not passing, and we will continue to push for Medicare for all. We're just disappointed that the platform says that they will be opposed to the TPP, and yet their spokespeople are not following that party line. So maybe they didn't read the memo. We'll give them the benefit of the doubt there, but it really feels disingenuous when they say things like that.
And finally, the issue that many people have associated with you and Senator Sanders on single-payer health care, it's something that California and the California Nurses Association helped pass a few years ago, and to have Arnold Schwarzenegger veto it, after the Assembly and the Senate passed it. Where do you look to take that issue? Obviously, the Medicare issue that reducing to 55. Where are you with that?
We're actually worried about reducing the age to 55 and buying into the public option, because what it does is takes the nation's sickest patients and moves them into Medicare and leaves the health insurance companies that are making profits with the healthiest people. So it really is doing a disservice to Medicare, and it's doing a disservice to the taxpayers because we subsidize those insurance premiums that the insurance companies are charging for the healthy people to buy.
Deborah Burger, thank you so very much.